In 2016, more than 70 children were harmed by bacterial contamination. Now, they were in the office receiving routine dental treatments, but the water that was being used was contaminated. And this led to permanent tooth loss in these children, serious jaw surgeries, and it subjected them to some really harmful, strong antibiotics. I want to talk to you today about dentistry's top 5 dirty concerns. Now, as a practicing hygienist of 15 years, I've seen a lot of changes. And most recently through the pandemic, I've really recognized that dental offices are not up to speed with today's infection control practices. I want to talk to you today about the safer method. Now, these are 5 areas that I see are still of concern in today's dental practices. It's important for you to have your patients and your staff's safety in mind. Sterilization practices. Attention to dental unit water lines. Frequent hand washing. Environmental disinfection. And regular training. So no ifs, ands, or bacteria. Now, there's several steps in the sterilization reprocessing. More than 30% of blood exposure incidents are due to a lack of following proper protocols. Work practice controls, like wearing heavy-duty puncture-resistant gloves, will help reduce the chance of occupational exposures. Peel pouches, like you see in the bottom right-hand corner, they don't need to be stuffed with instruments. Your instruments need to be able to lay flat in the peel pouches so as not to cause a heavy metal mass that would prevent adequate drying in the sterilizer. And the autoclave is not a turkey. We don't want to stuff that autoclave full. We want to be able to allow air to circulate around those instruments so that they become sterile. Unsterilized instruments can lead to potential infections, causing harm to our patients. So now it's time to pay attention to dental unit water lines. And I'm talking about the water that's being delivered to patients during routine dental treatments. It's this narrow tubing that runs throughout the dental unit where biofilm likes to grow, that really soft, sticky substance. And this is due to a low flow ratio, and it's often frequented with stagnation, with those water lines that you don't use on an everyday basis. I still see offices that are not testing their dental unit water lines. Now, testing is highly recommended by the CDC, the EPA, the Association for Dental Safety, even your dental unit manufacturers. Treatment should consist of either a straw in your water bottles or in the form of a tablet, right? Jesus Christ. Now, a shock treatment should be implemented anytime you have a new system that's been placed or whenever you're introducing a new treatment product. We once thought that aerosols contained saliva, which had viruses and bacteria, but we now know it's primarily just water, potentially untreated water. And these aerosols can stay in the air for an extended period of time. And this can lead to healthcare workers breathing in these aerosols and becoming sick. Here's something that you might find handy. We're going to talk about frequent hand washing. Only 58% of people are noted to wash their hands after using the toilet. Hand washing is one of the most significant ways to reduce the spread of disease in healthcare settings. According to the World Health Organization, only 40% are compliant in healthcare settings with washing their hands. Hand washing should be done before and after glove placement, and then after any barehanded touching of contaminated objects or surfaces. Now, it's okay to use plain or antimicrobial soap unless you're going in for a surgical procedure. And then it's recommended to use an antimicrobial soap followed by hand sanitizer. Now, these alcohol-based hand rubs or hand sanitizers are perfectly fine when your hands are not visibly soiled, but they should contain anywhere between 60 to 95% alcohol content. Let's spray away a few of the myths with environmental disinfection. Now, environmental cleaning or disinfection pertains to the ops, waiting areas, restrooms, and everything in between. Clinical contact surfaces should be cleaned and disinfected in between patients. And the use of an FDA-approved barrier should be used on any items that are difficult to clean, such as your keyboard, your mouse, even the handle where your handpiece sits. And housekeeping surfaces are perfectly fine to be cleaned with a water and detergent. Now, these are your walls, your floors, your cabinet doors, but you want to be sure to use a fresh mix on a daily basis. Now, dentistry can be filled with harmful substances, and dental healthcare personnel are subjected to these harmful substances on a daily basis with environmental cleaning. It's important to minimize your exposure to these highly concentrated chemical products. Wearing PPE is extremely important, so you're protecting yourself from these sprays and these wipes. Now, alcohol has been used in dentistry for infection control for centuries, but you'll never find it in any liquid chemical sterilant or high-level disinfectant. In fact, studies show that alcohol can bind animal proteins to stainless steel instruments during sterilization. And glutaraldehyde, or more commonly known as cold steril in dentistry, it's not even recommended for use in dentistry anymore. It requires special testing, it requires special ventilation, and even special disposal procedures. Training is one of the most essential components to having a successful practice. Are you training your office employees on your written policies and protocols? Do you understand that it's a requirement to have written policies and protocols in place? Even for those employees that are not licensed, they should be up to date on your protocols. As dental professionals, we understand that these deficiencies need to be addressed. It's important for your team, it's important for your patients, and it's important for the office as a whole. Today we talked about the SAFER method. What do your patients see on an everyday basis? Infrequent hand washing, inadequate training, improper sterilization procedures. We want to make sure that your patients see the safety practices that you've put forth. While there's a lot more to this, the SAFER method that we discussed today will allow for you to know that your staff and your patients have their safety in mind.